Hey guys, happy Tuesday. Time for 2-Bit Tuesdays. So there's a product I mentioned, I think a couple months ago, that it's worth mentioning again because I'm saving people a lot of money. So it is a guaranteed issue PPO plan that utilizes the PHCS network. And so there's no health questions. There is going to be a waiting period for some pre-existing stuff, but if you have marketplace coverage right now because you have pre-existing conditions and we weren't able to do something different for you this year, this is could be potentially a good fit. Obviously, we need to evaluate to see where you are with your pre-existing condition, if you're on a bunch of meds, things like that. We need to do a cost evaluation. But if you're paying, this particular person that I helped was paying $1,200 a month for their plan on the marketplace. They didn't qualify for a tax credit, so they're paying full price. Their conditions are well maintained, so they're taking some meds, which are generics. And I was able to save them half. So now their premium is $615 a month. And they will have copays to go to the doctor. You know, obviously, if it's for their pre-existing condition, that is probably not going to pay for the first 12 months. But if I'm saving you $600 a month on premium, can be a huge savings. And even if you have to pay out of pocket for a couple doctor visits or some medications, again, it's the bottom line we're looking at. If I can save you a ton of money on premium, still have coverage in case something bad happens, then this could be a fit. It also could be a fit if we're outside of open enrollment, which we are, and you don't have coverage. And you need coverage, you're worried about not having coverage. This could also be a fit for you. And again, it's an evaluation. We can always reevaluate during open enrollment. But this could be a very good fit for you currently. So no one will be turned down, but I will review any pre-existing conditions you have and how that would work with the plan to make sure it's still a good fit. But talk to people every day that are struggling to meet their insurance premiums. And if you don't qualify for a tax credit, you can cancel that plan anytime on the marketplace. So a lot of people don't know about health insurance. It's usually month to month. Through an employer is a different story because you can't cancel anytime. But if you have an individual plan, it is month to month. You can cancel. We can switch you to something that doesn't require an open enrollment and have other options. Even if you are healthy, there are more options than the guaranteed issue option, which could be actually a little cheaper than the guaranteed issue option. So if you're struggling to meet your health insurance premiums, but want maybe a PPO, want something that's going to cover you in case something bad happens, this could be a great alternative. Hop on my schedule and we'll do an evaluation, determine what's best for you. Until next week, peace out.